it is my absolute proud privilege to invite Padma Vibhushan Dr. Pratap C. Reddy, Chairman, Apollo Hospitals, to deliver the special address on a vision for the next decade, making high-quality home care accessible to every Indian household.
Greetings to all of you. Namaste. It's been a very pleasant thing to hear that one of the important divisions of healthcare, home healthcare, has now achieved a decade of service. But it takes me back almost 50 years ago when I came back from US. I was really saddened that there was absolutely nothing available, and we were truly a third world healthcare service. So, being a doctor, when you see patients who could have been helped if their facilities were there, and it is not there and we lose them, it hurt me so badly. Especially in '79, I had a young man who was only 38-year-old with 2 children. When he was to go for surgery 2 years because there was no cardiac surgery in India, and so he couldn't go because he couldn't raise $50,000 to go to Houston for surgery. And that what made me saying, why shouldn't we have it here and give it to our people? What was needed is the human skills. These human skills purely, I have seen Indian engineers, Indian doctors, Indian technologists were equal in US. The 10 years which I spent, I don't think in any space, in an Indian doctor or Indian technologist was anything less. So I said, when we have this, what is needed? Then of course, what is needed in a hospital is a backup service. Unfortunately, the government of rules then was that for custom duty, to import one of the equipment that we have to save the people at home, it was 320%. It's called a luxury. And Baba, the patient is suffering, he needs care, and you call it pleasure, call it 320% duty. And then they could fund a hotel, they could fund probably a cigarette shop, but the funding was not available for hospitals. So, but everything was in Delhi. I went many times to convince each of these people, but finally I am happy. Whatever efforts that I took, when Ganesh Del Singh inaugurated our hospital in 1983, September 18th, that became a remarkable day for healthcare in the country, because it's not just for Apollo. Apollo, yes, we have continued and done excellence in every single field of care. It started with cardiac, but we didn't stop there. On day one, we made a multi-special hospital. Today, the care that's given in Apollo Hospital and every single field of medicine is on par with the best centers anywhere in the world. I must speak to I'm a cardiologist, and it started with cardiac surgery. In cardiac surgery, we have done 231,000 cardiac surgeries, and that's the highest number in the world. And in healthcare, it's not the numbers, it is the quality of work. This is what Apollo is proud of. This is what I am proud of Apollo family, who has delivered this excellence in outcomes. Our outcome in heart surgery is over 99%. This is nowhere in the world they have got it. So in everything that we have done, it is because that spirit in each of them, they brought out the inner strength, and that's what made Apollo, and now there are another 300 good hospitals in the country. This is why I told our Prime Minister, India can today become global healthcare destination. And sent few suggestions what can be done to make it happen. So he immediately called us, Preetu, Sunita, Sangeeta, and my wife said, why shouldn't I also not come? So she also came to the Prime Minister, but it was on business. First 20 minutes. He said, I like this concept. This is very good. We must do it. And we will do it now. And the only thing is, I want to suggest a name from, I said global healthcare destination. He said, I want to call it as Heal in India, because way back in 750 BC, Sudhar made the first diagnostics and I agreed. I also gave him another paper that there's a huge need of doctors, nurses, healthcare people around the world, in the world. Even India is going to be short of it. So I understood from his secretary that after we left for 1.5 hours, he spent another 2.5 hours to direct the various ministries, and work started. And the very first year, he added 49 nursing colleges, 49 medical colleges, 110 nursing schools, and various other technological courses. Today, last year budget, she announced saying there is going to be provision for another 70,000 professionals to be trained. I'm sure this budget she will further increase. Sunita has already met her. I'm sure she would impress saying it. And what I would like to say on this is because we need it and we can do it, and we have done it. So this is the three, and then now our aim is Heal in India, Heal by India. My third youngest daughter, Sangeeta, is not here. She started another thing called Heal the World from India. That means we can do the patient's reports come back and then handle them. So I think this is the pride. As an Indian, I am proud now today, saying that there is nothing, no field, whether it's a heart transplant or a lung transplant or liver transplant or major neurosurgery, all are done in India. The proton, when we brought proton to Chennai, there was no proton in the UK, no proton in Southeast Asia, and Singapore and Australia. So I think what I am trying to tell this is to say that we have come to a very good stage. This is the time we should jump and say, we can help and make India a healthy nation and give it to the world. Because the same, as I said, that the deficiency of healthcare people is about 8 million this decade and 30 million by the time 2040. So I think only India has got the young people to deliver this. So we have that. Similarly, in home care, when we thought of it, there was a huge necessity. Because one of the patients told me that if I go home, who will look after me? So I think that's a very nice question that really touched on me. Then the concept came home care. Thanks to the team. Now, thank Jawahar and his team now. We are celebrating a decade of service. We have done a brilliant work. But remember the word what Peter said. Peter said it's a brilliant beginning of the next decade. So there's a huge need for this, and I think I can do everything possible today because the technology is available. And at Apollo and in India, technological services have become very easy to adapt, and our people are very intelligent in adapting this. So that is not in the back. And as an institution, we are willing to back. Apollo today is like a banyan tree. There is nearly about 17 branches. Each branch like this is going to make a significant impact in giving the services to people. And I think my Apollo family worked so hard with only one purpose, saying, the patient has trusted and come to me, I must do the very best for them. Very often, the nurse or the doctor has not left her because it's 5 o'clock on his duty or is over. So I think that's the only thing which helped us to achieve this level of healthcare delivery in the world. God bless all of you. I assure you the Apollo family will be continuously part of your family to keep you healthy and happy. My future vision is very simple. H, H, and H. Health, happiness at home. Good luck.